I'm just wondering, this morning we heard from Nancy who says that those who don't want to wait for an mRNA vaccine should get AstraZeneca, whereas before we've been given advice to get the first vaccine available to us. Can you talk to us about why this advice has changed, and what do you say to people who got AstraZeneca who are now thinking, or maybe second-guessing, getting this shot?
Yeah, so I think NACI has always had the recommendations based on the comparison with the mRNA vaccines, but the advice still stands. With the amount of transmission we are seeing in this province and in this country, then the best advice that I can give and that we, my colleagues across the country give is the first vaccine that you have access to is the one that you should get. And that includes AstraZeneca vaccine. We know that there's this safety signal, and for some people, they may want to wait that period of time for, could have been several weeks to months at many points in time. But let's be very clear. We have good information, really good data, real-world data from the UK that shows that a single dose of AstraZeneca or Pfizer vaccine provides excellent protection, very high protection, in the high 80% protection against transmission of the virus, but also the serious illness, hospitalizations, and deaths. And more recent studies have shown that both AstraZeneca and Pfizer vaccines prevent you from getting infected yourself and make it less transmissible to your family if you do get infected. So both of those were equally effective vaccines at preventing transmission within families and households, and that's really important. This is great information that helps us understand that both of these vaccines work very well. And so I still encourage everybody to receive the vaccine that is available to you first. And I can say that my family members received the AstraZeneca vaccine, and we will be making sure that you have access to the information you need about second doses of AstraZeneca vaccine when they're available as well.
Binder, did you have a follow-up?
I do. And just actually following up on what you said there, you talked about people who are getting messages when they register with the provincial system, if they are at an age where booking is allowed, that they can book their first dose, even though they may have already had their first dose at a pharmacy or workplace. I guess people are wondering, why isn't that data from pharmacies or other places being shared with the provincial system right now? Is there a chance that someone could get missed here? And is there anything that's actually stopping them from booking their 2 shots of Pfizer?
No, there isn't, though I wouldn't recommend it to people. But it is the challenges that we have with building an IT system that allows us to have that ability to match vaccines to populations around the province. So it is a really important, and it's going to be a very helpful legacy system, but we've been building it as we go. So we do have a provincial immunization registry, and that's the basis that every vaccine dose goes into, and that's one we've used for many years, that we have all our childhood immunizations in. You will remember about 2 years ago we came out with a requirement that school-based immunizations be recorded in the provincial registry. So that registry, that's the basis of where every single dose of vaccine gets into that registry, whether it's from a pharmacy, whether it's at one of our clinics, whether you got immunized in a community or in your workplace. They all go into the basic PIR, we call it, the Provincial Immunization Registry. There is now this whole registration and booking process layered on top of that. So the information about every single dose goes into the registry, but it's coming in from different places, and that is all now being moved into one single provincial, supposedly seamless program. But in doing that, and anybody who's worked on these big IT projects knows that there's always glitches and there's things that come up. And so I, for example, have had my first dose, of course, of Pfizer, and got a notification that I was eligible for my first dose because of my age coming up in the past week. And we've recognized that that's a glitch, and they're going to be fixing it. So there's not, we don't believe there's a risk of people being missed. It's the other way around. So pharmacies do report the information into the immunization registry. There can be a delay in that, and that's one of the challenges we have with working with the many pharmacies and the systems that we have. So it is much more likely that people will get in there twice. And that's okay. If you've already had your vaccine, you can ignore that second invitation, and you will get an invitation for your second dose when that's due. The other thing that will allow us, the system will allow us to do as we work out these bugs in the next little while, is when, right now it flags when you're at about 13 weeks so that we can make sure people get booked for their appointment before the 4-month second dose interval. But if and when vaccine becomes available, we can move that up, and the system can notify you that your second dose is now going to be at a shorter interval.